Good afternoon. My name is Jeffrey Goins. I'm a student, a registered nursing student at Northwestern State University. And today we're going to be doing a Foley catheter. The first thing you do when you receive instructions for a Foley catheter is to check the provider order and make sure it's correct. Next thing you do is you gather your supplies and then you head to the patient's room. When you get to the room, you do hand hygiene. Introduce yourself to the patient. Ask them to verify their name in two ways. So name and date of birth compared to the hospital band. I'm going to explain to the patient what we're going to be doing today, the procedure, and obtain their consent. I'll also ask the patient if they have any allergies such as betadine, shellfish, latex, or any adhesive allergies. I'm going to raise the bed up. Comfortable working at level. There we go. And I'm going to I'm going to cover the patient with the bath blanket just to preserve privacy. Once again, obtain consent and make sure that they understand the procedure through education. Ask them to hold the sheet up here at the top as I remove the undersheets. And then if they're able, have them assist me in getting themselves up into the dorsal recumbent position by bending their knees and placing their feet about 2 feet apart. Move it back a little bit so I'll be able to edge it back with my elbow, but still maintain privacy. Come over and open my supplies. I use the baggie, the trash bag. And place it down here at the foot of the bed. Make sure that this isn't going to fall over. And now, corner up, corner to the side. Corner to the side, and towards me. I'm going to reposition this. That's great. And surgical gloves. And the second barrier. Making sure to only touch the corners. We're going to position this under the client. And the male barrier, getting it out of the way. Now, for the surgical gloves. And around this side to have. Making sure not to touch the barrier. And the edges. All right. Non-dominant hand on the cuff. Hand in. Fingers. Thumb out. Push down under the cuff. Up. Thumb out. Hand in. No longer need this. Now I'm going to prepare my supplies.
I'm going to ensure that my bed holds it up, the bed's in the lowest position, and it's all bells within reach. And I'm going to come back and reassess.
Rip the top of this.
No, you got it.
Do you think you want me to do it?
No.
Okay.
Remove my swabs.
Take it out.
Yep.
Place them in there. Sterile. Trash.
So, I had another pair of gloves over here, just in case.
Petroleum, or the lubrication. Open.
Need yours.
Oh, I need all of it.
Remove the tray, the top tray.
Do the second part.
Remove the cup, the specimen collection cup. Now I'm going to very carefully remove the wrapper.
No, I mean, I didn't see. Very good. Check order.
Trash.
Clean gloves.
Alright. Grab my sterile water. Remove the cap. And connect it to the catheter. While placing it back in the box. Grab my lubricant. Squirt it into the corner of the box. Have it ready.
Was that in the video?
That up.
But not pictures on it? Okay, that's what I'm gonna pretend like it's.
Now we're gonna put, verify that I have everything straight. That's connected. Then gonna put the top tray back in the box. Transport it to the client.
Clean gloves to take it out.
Turn it away from anything that may jeopardize sterility.
Clean gloves, green bag. Take the glove off, put the glove on.
And move this bag just as far as we have to. All right.
In the patient's room, I've already checked in my order and gathered my supplies.
Clean that hand and spread the labia.
Okay, I'm gonna educate my patient on what we're gonna be doing.
First swab is going on the far side, front to back.
Okay, I'm gonna get my patient to position.
Around.
First, I'm going to drain the bag.
The second swab will be going on the near side,
I'm going to put on some
front to
gloves.
back. Coming around close. And the last swab will be going down the middle. Front to back. Coming around the near side. Wrapping it. Take the top of the tray out now. Place it back on that sterile film. And grab the catheter tube. I'm going to instruct the client to take a couple of deep breaths and then bear down like they're trying to void. Lube up the tip. the catheter. Alright, now bear down like you're trying to void. I'm going to insert it about 3 inches until I see a flash of urine, and then I'm going to further advance it about 1 to 2 inches. I'm going to grab the tube with my committed hand, and I will inflate the balloon. Make sure it's in place by retracting it until it stops and removing the syringe. Sterile portion is over. I'm going to take the tube, and I will make sure that there's slack in the tube coming over the thigh. I will attach it with tape. Alright, tube is attached. Now I'm going to take the bag and label it with my name, the date and time that it was attached. And I'm going to hang it from a non-moving portion of the bed. Definitely not the bed rails. Got the label on there. I'm going to assess the urine that's come out in the bag for the amount, the color, and clarity of it. I'm going to come back up, remove the trash, and cover the client back up for privacy. Get this trash out of the way. Alright. I hope the patient gets comfortable again. And cover her back up. I'm going to educate the client on keeping the Foley bag below her bladder, so below the edge of the bed, and also instruct her to increase her fluid intake. Let her know that if she has any questions or needs to get up to let me know so that she doesn't just yank on that. I'm going to put the bed rails back up and return her to a safe position. Alright, grab the call bell, place it with the client, and remind her to let me know if she needs anything. And that concludes the insertion of the Foley catheter. Put it on this. Oh, no, pause it. Alright. Good afternoon, my name is Jeffrey Bones. Today we're going to be doing a catheter removal. First thing you do when being instructed to do that is check the provider order and gather your supplies. Coming into the patient's room, introduce myself, verify the patient in 2 ways, check the wristband for the name, date of birth, have them verify it. Alright. Educate the client about what we're going to be doing today and ask them if it's alright, obtain their consent. Do hand hygiene and gloves. before we actually get into removing the catheter, I'm going to inspect the urine for the amount, color, and clarity of it. Then I'm going to drain the catheter bag. Move the client up to working position. Put the bed rail down, cover the client with the bath towel or bath blanket, trying to keep her privacy. Client to hold the top of this sheet so that I can just pull this down underneath. There we go. I'm going to position the client in the dorsal recumbent position, the knees up, and spread about 2 feet apart. Move this back on as far as we need to. And place a sheet saver. Underneath, just in case there's any little dribbles. Remove it. Let the client know that they're going to feel a lot more relieved after we get this out. Now, over the field, place the syringe in. Remove the sterile water, and it should just slide right out, keeping it over there. We're going to assess the tubing make sure that the tip is intact, and there it came out. Gather all this out of view of the patient. I'm going to assess the catheter location for any arrhythmia or swelling, any lesions, make sure that there was no breakdown of the skin. Cover the patient back up, keeping this out of view. And move the bag. Dispose of this. Put in the trash in a moment. Reposition the client, make her comfortable, and cover her back up. Remove the bath blanket. Alright. Now I'm going to educate the client about the first time she voids that we need to be informed There might be a little bit of blood. That's normal, but we need to assess the urine. She'll be going to the bathroom for the first time in a plastic hat that'll be inside her toilet, so that we can collect the urine. Let her know to contact us if she has any questions or is uncomfortable. And I'll be back in about an hour to check on her. And I'll put the call ball next to her, bed in the lowest position, bed rails up ×2. And this concludes the Foley catheter removal.